Medicare Advantage encompasses many different things. So PPOs, HMOs, cost plans, private fee-for-service, there's even more than that. I'm going to break it down a little bit and explain what Medicare Advantage is a little bit more in detail. Stay tuned. Hi, I am Sylvia Gordon, also known as Medicare Mama with the Medicare Family.com, and I want to talk a little bit about Medicare Advantage plans. First of all, let's talk about Medicare Advantage versus Medicare Supplement. So when you first sign up for Medicare Part B, you're going to supplement your Medicare with something, either Medicare Supplement or Medicare Advantage. And a simple which road we're going to go down is Medicare Supplements, you're going to pay higher amount up front. So you're going to pay for Plan G if you're male or female turning 65 in most states except New York and Florida, a bit less than $150 a month in 2022. And then you will pay a small deductible depending on what plan you get. You don't need any referrals. You can go anywhere in the country, see any doctor. There's no network. So that's a brief, simplistic view of what a Medicare supplement is. And some people call it Medigap. It can be a Medicare supplement plan F, G, N, K, L, a lot of different plans that are out there. Typically, people are buying a Plan G or a Plan N. So that's Medicare Supplement world. We're going to talk about Medicare Advantage, which is an alternative. So you're either going to go with the Medicare Supplement, you're going to figure out which one of those plans best fits your needs, or you're going to go with Medicare Advantage, and you're going to figure out which one of those plans best fits your needs. So it might be a PPO, an HMO, a cost plan, a fee-for-service plan. It depends on where you live, what's available. Medicare Advantage, you don't pay a big monthly upfront premium like you do on a Medicare Supplement. Like I said over here, it would be on average $150 a month. On average, a Medicare Advantage plan would have $0 a month. Now, you have to pay Medicare Part B if you go with either plan. So that's going to be neutral. Many Medicare Advantage plans don't charge you a monthly fee, but you will pay a copay every time you use it. If you go to the doctor, if you go to a specialist, go to the ER, have outpatient surgery, inpatient surgery, etc. So if you don't use it, you could potentially not have to pay anything to the insurance company that month or for all year. Now, Medicare Advantage, you do have a network of doctors. It might be a huge network. It might be a very small network. You might need a referral to see a specialist. And the thing that's really attractive on Medicare Advantage is there might be a lot of extra benefits that you do not get from Medicare supplements. And that's what you see all over the TV. Transportation to and from the doctor, your pharmacy, maybe the grocery store. Dental, vision, hearing, massage, chiropractic, meals after surgery. Some give pest control. Some give money that you get every quarter. There's many different extra benefits. They're called supplemental benefits. And these all vary. All the benefits on a Medicare Advantage will vary depending on what insurance company you use and what county you live in. So let's go back to deeper in Medicare Advantage. There's two main types. Most people are on an HMO. My favorite plan is a PPO. A lot of people ask me, what would you buy if you were turning 65? I would buy a PPO. PPOs cost a little more than HMOs. But with a PPO, you have a larger network. And that gives you a lot more access to see doctors. And you're like, well, I only see one doctor, but why do I care? You buy insurance in case you get sick, in case something bad happens in the future. Something bad happens in the future, I want to be able to go outside of my network. I want to be able to go to Las Vegas or Jacksonville, Florida, or Houston, some of these centers of excellence. If you have an HMO, a lot of times you're not allowed to go out of your network. It's very restrictive. Now, this varies based on the plan you buy and the year. So your plan might not have had it this year. It might have been more restricted this year. It might be more lenient this year. Medicare Advantage does change every year. Whereas a Medicare Supplement, when you buy it, it's the same for the rest of your life. As long as you pay your premiums, they can't change it. Medicare Advantage does change every year. Sometimes the benefits get richer. Sometimes the copays go down. It just changes every year. So it's just something to keep in mind that you're buying a year at a time. Why do I like PPOs? It costs a little bit more. Copays are all a little bit higher, but I'm giving myself that ability to go nationwide. And for me, that's worth it. Now, if your budget's really tight, or you have a lot of supplemental benefits here in the middle that are really attractive to you that are not available in the PPO, and you're like, I gotta have hearing aids, and I can get a hearing aid on this plan for $1,500 copay. Get the HMO. You know, you're only stuck with it for 1 year. You can always switch between plans every year. With Medicare Advantage, they can't ask you any health questions. Nothing. You're covered day one. There's no pre-existing like you might have on a Medicare Supplement. With a Medicare Supplement, if you want to switch between Medicare Supplement plans, you got to be able to answer the health questions in most cases. Now, there's some states that get around that rule, but the majority of the country, if you're on a Medicare Supplement Plan G and you've been on there for 3 years and you're like, price is getting a little high, and you want to shop for another Medicare Supplement Plan G at a lower price, you have to be able to answer the questions to go there. With Med Advantage, every year, if you want to move, you just move. They're not going to ask you any health questions. You're never paying more because of your health. You're not rated up because you're a smoker or because you're overweight or because you already are in cancer treatments. You don't have that on Medicare Advantage. So that's just a brief explanation of what's going on with Medicare Advantage. If you need help making your decisions, call us here at the Medicare Family, 1-800-970-1964, or ask us in the comments. Tell us when's the best time to reach you, and we'll reach out to you.